contact lens abuse and noncompliance is the primary reason that a contact lens wearer will develop complications. As can be seen here, it's easy to see how this patient is increasing their risk of developing contact lens complications. The contact lens has significant deposits present on its surface because of the patient's poor lens care. Oftentimes, patients come in with what appears to be complications secondary to noncompliance, but the contact lenses seem to be well cared for. Oftentimes, we consider the contact lens patient with any adverse signs on the ocular surface as a non-compliant lens wearer. But we need to be careful to not always assume this and to consider other considerations and clinical conditions in our differential that can also affect the ocular surface. Take, for instance, the contact lens wearer who presents with diffuse corneal infiltrates. Although contact lens abuse is a leading cause of this, we need to keep in mind those ocular conditions other than lens abuse that can cause this. Thygosine superficial punctate keratitis presents with corneal opacities that stain with fluorescein. Adult inclusion conjunctivitis can present with infiltrates along with diffuse conjunctival hyperemia. They'll respond initially to antibiotics topically applied, but the ocular response will recur when the topical antibiotics are removed or discontinued. Several other conditions can be present with corneal opacities such as epidemic keratoconjunctivitis, epithelial dystrophy, and dry eye. We found it important to perform an Adeno+ test, which is a relatively low-cost point-of-care test that determines the presence or absence of adenovirus. As can be seen here, when adenovirus is present, there will be a red line that appears right next to the blue line in the viewing window, which represents the control line. Contact lens abuse occurs in a number of our contact lens wearers, but remember that there may be other etiologies that are causing the acute red eye and infiltrates. And consider point-of-care testing to help aid in appropriate diagnosis of these patients. We hope that you have found this clinically insightful.